Good afternoon. Hey, I'm Dr. Bill Christenberry at Caldwell Mill Animal Clinic, and one of the things that we get asked about a lot here at the clinic is about heartworms. And there's a good reason for that, because heartworms are out there. They're a problem for dogs. They're can be a problem for cats too, and they even can infest humans in very rare cases. But I wanted to have a little three-part series about heartworms to try to help educate everybody and let the whole community understand a little bit more about heartworms and how we deal with them and why we deal with them. So first of this series is about the life cycle of the heartworm. First of all, as a lot of people know, heartworms are carried by mosquitoes. And what happens is a mosquito comes and bites an infected dog, and the infected dog has microfilaria, which are actually baby worms of an adult worm that's living in that dog. And they're in the bloodstream. They're swimming around. When we draw a blood sample out of a dog that's infested with heartworms, you can put a drop of that blood on a slide, look at it under the microscope, and you can see those worms swimming around. They're microscopic, and so when a mosquito bites and sticks his mouth part into a dog, draws blood out, which is what mosquitoes do. They drink our blood. They pull out some of those baby worms. Then those baby worms go into the mosquito's body, and then they go through a series of molting through their larval phase. So a lot of times people think that mosquitoes, they have a heartworm inside them, and then they bite a dog, and then they go directly to another dog and infest them. And that's not what happens, because they have to go through a molting cycle to a certain larval stage before they can become infected. So that happens over a period of time with the mosquito. A mosquito flies around, lives its life while that larva is going through a molting process. Then it goes and bites another dog, and then it basically regurgitates that larval stage of the heartworm that's infective into the non-infected dog. It gets into the wound where the mosquito has injected its mouth part to drink blood, and then that larva makes its way into the skin and eventually into a blood vessel, a capillary, and then takes the river upwards until it gets to the big river and into the heart. And then the heartworm matures and sets up its home in the right side of the heart, where it lives and matures. And there can be, as a lot of times, as few as maybe 5 heartworms. I think the most that they've ever found in a dog was 120 heartworms. And they live, like I said, and they live in the right side of the heart. And if you know cardiology anatomy or cardiopulmonary anatomy, the right side of the heart pumps blood to the lungs. And so that's why one of the main symptoms we see with heartworms is a dog that coughs. And the reason is because that heartworm, or those heartworms, are living in the right side of the heart, and they are living creatures. They're worms. So they produce waste, and they reproduce children worms. And where do those go? From the right side of the heart. They get into the bloodstream, and they go directly into the lungs, and they get into the pulmonary circulation. They get into the lung tissue and cause irritation, because basically, like I said, they produce waste, and that means that heartworms are peeing and pooping into the right side of the heart, and that's going right into the lungs, and that's just gross. But that's the way it is, and that's what happens, and that's why they produce disease in dogs and in the heart and in the pulmonary circulation. And as I mentioned, they reproduce the baby worms, the microfilaria, which float off into the bloodstream, and that brings us back to the beginning of the life cycle that I mentioned earlier, when the mosquito bites a dog, an infected dog, pulls the microfilaria out, and there the process begins again. So that's sort of an overview of the life cycle of the heartworm. Hey, thanks for listening, and stand by later for the next in our series about heartworms.